before we got to the clinic, we didn't know what Laura would be prescribed with. We were hoping she would get antineoplastons, but they did say to us, we're not going to know until you arrive and we submit all your medical records to the FDA. They'll determine whether they're going to approve Laura for treatment or not.
The patients that wish to receive antineoplastons are required to go through a rigorous review process by America's Food and Drug Administration, which generally requires proof that chemotherapy and radiation have first failed the patient before being allowed access to antineoplastons.
So we got back from getting the biopsy result, and I straight away phoned the clinic and told them what Laura's tumour was. And he said, look, I'm really sorry, but it's a clinical trial and there's criteria. Laura's going to have had radiotherapy or chemotherapy first and failed that. I said to him, well, that's crazy. What do you mean failed that first? And I said, what, we're UK citizens. Does it matter that we're not Americans? Do we still come under the same law? And he said, yeah, you'll be on US soil when you arrive. The clinic's on US soil. We have to adhere to this.
But we just said, let's just get on with it.
Got on with it, yeah.
I went for the 6 weeks radiotherapy. I did 10 days of the chemotherapy, the Temodar, and I was violently sick.
Even if the FDA's prerequisite is fulfilled, the FDA holds full dictatorial rights to refuse patients access to the medicine if they choose.
The doctors have told us basically there is no cure. By contrast, Dr. Burzynski, we have found out, has cured several people with myeloma, which means that this is a better prospect for us just statistically. The problem is that the FDA, in its wisdom, will not allow us to be treated with the antineoplastons.
We have asked the FDA what is different about my case, why I don't get an exemption. We didn't have a response yet to that question.
They're not going to allow Pat to be treated by the clinic that has the technology to possibly save her life.